Berbice man drowns during family outing in Essequibo. Guyana Times. A family outing on New Year's Day at Lake 11 in Hughes, Dialysis, Region 2, Pomeroon Supinam, ended in tragedy when 36-year-old Guyana, also known as Karen or Bud, drowned while swimming with his young son. Reports indicate that Guyana, a resident of No. 3 Village, West Coast Berbice, had traveled to the Essequibo coast to spend time with his wife, son, and other family members. During the visit, a family outing was planned, as he was only in the region for a short time. At approximately 4:30 p.m. on Wednesday, Guyana entered the lake with his 6-year-old son, carrying the child on his shoulders. Witnesses reported that he veered into the deeper part of the lake and subsequently went underwater, while his son remained at the surface. Bystanders rushed to assist, successfully rescuing the child, but unfortunately, Guyana disappeared beneath the water. An alarm was raised, prompting several search parties to comb the area as night fell, but initial efforts yielded no results. The search resumed on Thursday, and tragically, Guyana's lifeless body was recovered from the lake. The body has been taken to the Surpass Hospital mortuary, where it awaits a post-mortem examination. The family and community are mourning the loss of Guyana, and condolences are being extended during this difficult time. Mohamed drops lawsuit after Sergeant Bascom apologizes over murder accusations. Contractor News. Prominent businessman Mohamed has officially withdrawn his $200 million lawsuit against Police Sergeant Dion Bascom. This decision follows Bascom's apology regarding accusations that implicated Mohamed in the murder of Ricardo Fagundes, also known as Paper Shorts. Fagundes, a 42-year-old gold miner and biker from Kitty, Georgetown, was tragically gunned down outside a popular nightclub on Main Street in March 2021. At the time of his death, Fagundes was socializing with his friend Roger Khan and others at the establishment when he stepped outside to move a vehicle closer to the entrance. Witnesses reported that two men emerged from a white-tinted Toyota Fielder wagon and opened fire with high-powered weapons before fleeing the scene. Following the incident, Bascom made allegations on social media that implicated Mohamed in a cover-up related to the murder investigation. In response, Mohamed filed a lawsuit seeking over $100 million in damages for defamation, along with a mandatory injunction to prevent Bascom from further disseminating defamatory content. However, in a recent statement to Contractor News, Mohamed revealed that he has decided to drop the case, stating, "We just dropped it because it's a waste of time going after that. We didn't have anything to gain from it, and Bascom reached out and apologized, so I forgave him. I'm sorry for him. He is out of a job and is in a real bad situation." Mohamed's attorney, Naresh Punai, had characterized the allegations against his client as false and malicious, asserting that they were aimed at tarnishing Mohamed's reputation, which is built on his philanthropic efforts and contributions to various charities and community initiatives. Bascom's accusations were made publicly on Facebook shortly after his arrest by the Customs Anti-Narcotics Unit, CANU, in connection with the cocaine discovery, a situation that has since added to the complexities surrounding this case. The withdrawal of the lawsuit brings closure to this chapter for both parties involved, as Mohamed emphasizes his commitment to moving forward positively. Hughes slams Jagdeo's veiled threats against political opponents. News source Guyana Nigel Hughes, leader of the Alliance for Change, AFC, has condemned recent statements made by Vice President Jagdeo, which he perceives as veiled threats aimed at potential political opponents. At a press conference, Hughes expressed his full support for anyone wishing to enter the political arena, emphasizing the importance of broadening political participation in Guyana. During a recent press conference, Jagdeo was questioned about signals from businessman Mohamed regarding his intentions to contest in upcoming elections. In his response, Jagdeo stated that while anyone can run for office, they would be subject to intense scrutiny of their affairs, a remark Hughes interpreted as a warning to Mohamed. Hughes asserted, "We believe in this country that any citizen who wants to run for office should have that right without being threatened, whether through veiled statements or outright intimidation. Political ambitions should not be stifled by the PPP." Highlighting a pattern of behavior, Hughes accused the People's Progressive Party, PPP, of historically targeting political opponents to settle scores. He characterized Jagdeo's comments as reminiscent of tactics from the old PPP playbook, where individuals are threatened with scrutiny of their tax records and other personal matters to discourage political participation. Hughes stated, "The message is clear. Individuals like Terrence Campbell, Mr. Mohamed, and others who dare to challenge the PPP must be cautious of the consequences. We reject any attempt by the government to pressure potential candidates." He emphasized that for Guyana to develop into a modern, democratic society, It is essential for citizens to freely exercise their political rights, particularly those who are popular and have valuable ideas for nation building. Future cash grants to be disbursed directly to bank accounts, Jagdeo. News source Guyana. Vice President Jagdeo announced that future distributions of the $100,000 cash grant will be made directly to beneficiaries' bank accounts. This decision comes in response to the challenges faced during the manual distribution process, which required individuals to wait in long lines for hours. During a lengthy press conference, Jagdeo explained that the government plans to leverage the upcoming National Electronic Identification Card (EID) system to facilitate these direct transfers. Although the implementation of this system has faced delays, he expressed optimism about its potential. We hope that with enhanced biometrics, we can significantly expand mobile money and online banking. We encourage every Guyanese to open a bank account, which will simplify the verification process. With solid biometrics, we can ensure that individuals are alive, well, and residents of Guyana, allowing us to deposit funds directly into their accounts, Jagdeo stated. He emphasized that using banking institutions for disbursement would streamline the process, addressing many of the challenges currently experienced in the ongoing registration and distribution of the cash grant. It would be the easiest solution for us to instruct banks to deposit funds into everyone's account, he added. Jagdeo also addressed the chaotic start of the $100,000 cash grant distribution for pensioners and public servants in December, which saw thousands flocking to distribution sites. He acknowledged the issues that arose and confirmed that registration in several regions will begin shortly. I apologize for what occurred in the North America region. It should have never happened. We will soon start registration in regions 2, 3, 5, 6, and 10, he announced. To facilitate ongoing registrations, the government plans to open offices in every Neighborhood Democratic Council, NDC, and 2 locations in Georgetown. You will be able to register if you miss the initial opportunities, he noted. Jagdeo reported that of the more than 370,000 individuals registered for the grant, over 100,000 have already collected their payments. GDF promotes 525 ranks for 2025. Guyana Times. Chief of Defense Staff, Brigadier Omar Khan, announced the promotion of 525 ranks in the Guyana Defense Force, GDF, and the Guyana National Reserve on Wednesday. These promotions reflect the GDF's commitment to recognizing the dedication and hard work of its personnel. The promotions were conducted in accordance with Part 3, Section 16 of the Defense Act, Chapter 1501 of 1977. The breakdown of promotions is as follows. Warrant Officers. 3 Class 2 Warrant Officers elevated to Acting Class 1 Warrant Officers. 1 Class 2 Warrant Officer promoted to substantive rank. Staff Sergeants. 2 Substantive Staff Sergeants promoted to Substantive Class 2 Warrant Officers. 3 Substantive Staff Sergeants promoted to Acting Class 2 Warrant Officers. 10 Acting Staff Sergeants made substantive. 8 Substantive Sergeants promoted to Acting Staff Sergeants. 42 Sergeants promoted to substantive rank. Corporals. 57 Corporals promoted to Acting Sergeant. 62 Corporals made substantive. Lance Corporals. 116 Lance Corporals elevated to Acting Corporal. 75 Acting Lance Corporals made substantive. 49 Privates promoted to Acting Lance Corporal. In the Coast Guard segment of the GDF, there were 32 promotions, including 1 Chief Petty Officer promoted to substantive rank. 2 Senior Petty Officers promoted to Acting Chief Petty Officers. 1 Senior Petty Officer elevated to substantive rank. An additional 28 ratings promoted or made substantive in their respective ranks. The Guyana National Reserve also saw 65 of its ranks promoted. Brigadier Khan congratulated and commended the promoted personnel for their unwavering dedication, hard work, and commitment to the service of the GDF and the nation. Government to surpass distribution of 50,000 house lots in 2025. The government of Guyana is on track to exceed its target of distributing 50,000 house lots by the end of 2025. In 2024 alone, a total of 10,791 house lots were successfully distributed nationwide, surpassing the yearly target. Minister of Housing and Water, Colin Crowell, shared these figures during the ministry's end-of-year press conference held at the Arthur Chung Conference Center in Linden-Soesdyke. Discussions about women empowerment and gender equality are crucial. Our analysis indicates that 46% of the house lots were allocated to females, while 28% went to males, Minister Crowell stated. To date, The PPP/C administration has allocated a total of 40,290 residential lots, with approximately 27% of these distributed in 2024. Region 4 accounted for the majority of allocations at 61%, followed by Region 3 with 22%. The demographic breakdown of LADs reveals that 53% are below 35 years of age, 32% are between 36 and 50 years old, and 15% are 51 years of age and above. Furthermore, 72% of allocations were made to individuals within the low to moderate income brackets, 19% to middle-income earners, and 9% to high-income earners. Minister Kroll emphasized the government's commitment to exceeding this year's allocation of 10,000 house lots, stating, "A dedicated team is working to acquire additional lands to facilitate this goal." In 2024, over 4,980 acres of land were acquired to meet the growing demand for housing. 19 new housing areas were developed during the past year, including Wales in Region 3, Good Hope, La Bonne Intention, Two Friends, Lusignan, Nonpareil, and Enterprise in Region 4, Waterloo in Region 5, Palmyra in Region 6, Amelia's Ward Fitz Hope in Region 10, Yarrowcabra and Horaruni along the Soesdyke-Linden Highway. Since 2020, more than 75 new housing areas have been established nationwide, marking a significant improvement compared to the period from 2015 to 2020, during which only 3 housing areas were developed. This initiative reflects the government's ongoing efforts to provide affordable housing solutions and improve the living conditions for all Guyanese citizens. Housing Ministry terminates contracts with 15 contractors. The Ministry of Housing has announced the termination of contracts with 15 contractors due to performance issues in several key housing areas, including La Bonne Intention, Prospect, Perseverance, and Little Diamond. This decision was disclosed by Minister Colin Kroll during the ministry's year-end press conference. Minister Kroll explained that these terminations were necessary following thorough evaluations of the contractor's progress. "I have seen on my desk several termination letters over the last couple of weeks," he stated, emphasizing the ministry's commitment to quality and timeliness in housing projects. To ensure a smooth transition for affected beneficiaries, the ministry has engaged directly with them. "We have worked one-on-one with the beneficiaries to ensure they are informed and that the completion of their projects will be handled by another contractor," Minister Kroll added. The decision to terminate contracts follows discussions held with contractors in late December 2024. While some concerns raised by contractors were deemed legitimate, the ministry concluded that terminations were unavoidable in cases of persistent underperformance. Minister Kroll reaffirmed that while the ministry strives to collaborate with contractors, it must prioritize the delivery of quality housing projects on schedule. One of the significant challenges facing the government's housing initiatives is the tight profit margins associated with constructing government-built homes, particularly the newly introduced young professional houses. Each house is being built for $24 million, and Minister Kroll indicated that a similar design would likely cost more if constructed privately, presenting financial challenges for individuals. The government's efforts to minimize housing costs have resulted in lower profit margins for contractors, which have, in some instances, led to delays and other operational issues. However, the minister stressed that once a contractor is awarded a project, they are obligated to fulfill the terms of the contract. This development underscores the ministry's dedication to maintaining high standards and ensuring the timely completion of housing projects, even as it continues to navigate challenges within the sector. Georgetown Public Hospital Corporation marks historic achievement with Guyana's first neonatal peritoneal dialysis. The Georgetown Public Hospital Corporation, GPHC, proudly announces a groundbreaking medical achievement: the successful administration of Guyana's first neonatal peritoneal dialysis. This significant milestone showcases the dedication and expertise of GPHC's multidisciplinary team and underscores the hospital's commitment to advancing neonatal care. On January 8, 2023, baby Lucknoth was born at GPHC's Obstetrics and Gynecology Department. What began as a routine birth quickly evolved into a complex case requiring exceptional neonatal care. Shortly after birth, baby Lucknoth developed breathing difficulties and was diagnosed with a severe infection, leading to his admission to the Neonatal Intensive Care Unit, NICU. A multidisciplinary effort to save a life. In the NICU, baby Lucknoth faced numerous challenges, including feeding difficulties and eventual kidney failure. Recognizing the critical nature of his condition, nephrology consultant Dr. Haim-Chand Baran was brought in to assist. The decision was made to initiate peritoneal dialysis, a life-saving procedure never previously performed on a neonate in Guyana. On January 25, 2024, the vascular/transplant team, led by Dr. Kishore Prasad and supported by Dr. Joshua Budial, successfully inserted a peritoneal catheter. A dedicated dialysis nurse played a crucial role in ensuring the success of this procedure. Over the following days, the NICU team meticulously managed the dialysis, supporting baby Luknoth through intubation and ventilator care. Gradually, baby Luknoth's kidneys began to recover, and his condition steadily improved. After nearly 2 months of intensive care, he was discharged on March 11, 2024. Today, baby Luknoth thrives at home with his family and continues to visit GPHC for follow-ups. As he approaches his first birthday, he stands as a symbol of hope and resilience, inspiring healthcare providers and families across Guyana. A step forward in neonatal care. Baby Luknoth's survival reflects the dedication and collaboration of GPHC's NICU team, with special recognition for Dr. Sarah Singh, Dr. Yaslis Reyes, and Nurse Laverne Tishmaker, whose compassionate care was vital throughout this journey. His case is part of a broader success story, with GPHC reporting a nearly 50% reduction in neonatal deaths compared to 2023. In 2024, GPHC admitted 955 neonates, with ongoing efforts to improve neonatal outcomes through enhanced protocols, advanced medical interventions, and continuous staff training. A vision for the future. The success of the first neonatal peritoneal dialysis at GPHC not only marks a historic moment for the institution, but also sets a precedent for the future of pediatric nephrology in Guyana. This achievement demonstrates GPHC's commitment to providing cutting-edge care and saving lives, even in the most challenging circumstances. As GPHC celebrates this milestone, the hospital remains dedicated to improving neonatal health outcomes and providing world-class care to every patient. Baby Luknoth's story is a beacon of hope, reminding us all of the profound impact of teamwork, innovation, and perseverance in healthcare.